Hi, welcome to Professional Certifications channel. Today, we're diving into a life-saving mnemonic that every nurse and healthcare professional needs to know, MONA. It's a quick way to remember the immediate interventions for a heart attack, or myocardial infarction. Let's break it down.
What is MONA? MONA stands for morphine, oxygen, nitroglycerin, and aspirin. These are the 4 key interventions we use during a heart attack to save lives. Let's go through each one.
1. Morphine. First up, morphine. Heart attacks are painful, and pain can actually worsen the condition by increasing stress on the heart. Morphine helps relieve that pain and reduces anxiety. But remember, it's used cautiously because it can lower blood pressure.
2. Oxygen. Next, oxygen. During a heart attack, the heart muscle isn't getting enough oxygen-rich blood. Giving supplemental oxygen helps improve oxygenation and reduces the workload on the heart. It's a simple but critical step.
3. Nitroglycerin. Third, nitroglycerin. This medication dilates the coronary arteries, improving blood flow to the heart. It also helps reduce chest pain. But be careful, it can cause a drop in blood pressure, so monitor your patient closely.
4. Aspirin. Finally, aspirin. Aspirin is a blood thinner that helps prevent further clotting in the coronary arteries. It's often given as soon as a heart attack is suspected. Quick action here can make a huge difference.
Why MONA is important. So why is MONA so important? It's a simple, easy to remember framework for managing a heart attack in those critical first moments. By addressing pain, improving oxygen supply, dilating arteries, and preventing clots, we give the patient the best chance of recovery.
Quick recap. Let's do a quick recap. Morphine for pain relief. Oxygen to improve oxygenation. Nitroglycerin to dilate coronary arteries. Aspirin to prevent further clotting.
That's MONA in a nutshell. And that's it. MONA is a must-know for anyone in healthcare. If you found this helpful, give this video a thumbs up, share it with your nursing friends, and don't forget to subscribe for more quick tips and mnemonics. Thanks for watching, and see you in the next video.